Schizoaffective disorder is a mental illness characterized by mood swings, hallucinations, delusions, and disorganized thinking. People with schizoaffective are prone to depression, mania, psychosis, and suicidal thoughts. They experience extreme highs and lows, alternating between periods of elation and despair. This pattern of behavior can lead to problems at work, school, relationships, and self-care. The most common form of schizoaffective is called bipolar disorder, where people experience episodes of both manic and depressive phases. Other forms include schizophrenia, borderline personality disorder, substance abuse, and postpartum depression. Symptoms vary depending on the type of schizoaffective. Some people may experience one symptom while others may exhibit several. Schizophrenia affects people differently. It may cause them to experience hallucinations, delusions, or both. Some people may feel depressed, others manic. Sometimes they may alternate between these two states. Psychiatrists often mistake schizophrenia for major depressive disorder. Schizophrenic behaviors include delusions and/or hallucinations. These may be accompanied by mood swings. Bipolar disorder can cause these kinds of behaviors during mania. Therefore, schizoaffective disorders are sometimes classified under the bipolar category. Schizophrenia is characterized by hallucinations, seeing things that aren't there, delusions, believing something that isn't true, and disorganized thinking. However, schizoaffective disorder has an unusual symptom presentation where people experience both positive and negative symptoms at the same time. Schizophrenic disorders fall into two categories, one where people suffer from depression exclusively, and another where they experience both depression and manias. Regardless of which type of bipolar disorder you have, once you get an accurate diagnostic assessment, mental health professionals will develop a treatment program that has good odds of success. Schizophrenia affects both men and women, but treatment options vary depending on gender. Antipsychotic medications are often prescribed to help control hallucinations and delusions, while antidepressant medications are prescribed to help manage depression. Mood-stabilizing drugs are sometimes prescribed to help prevent mania or hypomania from occurring again. It is important to monitor the effects of the medications you're using if you aren't in residential care. Your mental health professional needs accurate reports so they know whether the medications you're using continue to be appropriate and safe for you. Both exercise and a healthy balanced nutrition plan are important for maintaining good physical and mental well-being. Excessive sugar and fats, and all drugs and intoxicants, must be avoided if you want to maintain your overall fitness and focus. Meanwhile, exercise helps fill the brain with feel-good chemicals like dopamine and serotonin, helping people maintain their emotional balance and keep their minds healthy. Loneliness is a cause of depression. On the other hand, having someone close by boosts people's energy levels, breeds a feeling of optimism, and can actually improve their immune systems. Of course, avoid toxic people and stressful social interactions. However, having a warm and inviting environment at home can help prevent a descent into depression. Depression is always lurking in the background for people who've struggled with depression in the previous. A restless or depressed mind tends to struggle with sleeping well. It often doesn't get enough and may not be able to sustain a healthy and consistent bedtime routine. Insufficient rest can easily lead to feelings of anxiety and stress, which could send you into a downward cycle where a positive attitude becomes hard to keep up. Sleep hygiene refers to the way we live our lives so that we get enough restful sleep. It includes things like having regular bedtimes, not watching too much TV before going to bed, avoiding caffeine after noon, and making sure that you're well rested when you wake up. Schizophrenics who experience recurring thoughts and feelings should not disregard them, even if they seem to be minor, and they should be open and honest about these experiences with their families and therapists. If new symptoms or any change in the intensity of old symptoms occur, they might indicate that something else is going on. You may want to discuss them with your doctor. Or, if stress is causing these issues, you may want to consider taking some time off from work. After completing residential mental health recovery programs, many people continue to practice complementary therapies like yoga, meditation, bioresonance, or Tai Chi. These activities may help you manage stress, depression, and anxiety better than traditional treatments alone. Many treatment centers also offer self-help groups or classes in life skills or coping strategies. These help people learn how to cope better with stress and trauma. Counseling helps patients deal with issues such as depression, anxiety, anger management, substance abuse, relationship problems, and so forth. Vocational rehabilitation teaches job readiness skills and provides employment opportunities. Self-development courses empower people to improve themselves through education and personal growth. You don't need to react emotionally to everything. Instead, choose to feel positive emotions intentionally. And if you want to help yourself feel better, focus on doing things that bring pleasure and happiness into your life. Over time, your newly acquired positive outlook will become a habit. It will help you get through difficult times and keep you hopeful for recovery from schizophrenia. You must stay away from stressful situations when you're undergoing treatment for schizophrenia. If you feel anxious, you may experience symptoms of depression, which could worsen your condition. If you follow a regular schedule, then you're likely to be healthy. However, if you don't stay focused on recovery and healing, then you might not be healthy. After completing formal psychiatric treatments, recovery is a lifelong process, but the situation is especially fraught during the first few weeks and even longer after the completion of formal treatments. Fortunately, the best rehabs offer ongoing support for patients who need help managing their symptoms and recovering from the trauma of their illness. Aftercare shouldn't be ignored or taken lightly. If you're serious about making changes, then you need to take them seriously too. It doesn't matter if you're struggling with depression, anxiety, bipolar disorder, OCD, PTSD, etc., there is nothing shameful about seeking help for these conditions. You should be proud of yourself for overcoming them. If you accept your mental illness, you won't feel guilty for having it. And if you refuse to judge yourself for having it, you won't feel ashamed of it either. Seek help. People with schizoaffective tend to seek out medical care less frequently than those with other types of psychiatric illnesses. If you suspect that you might have schizoaffective disorder, talk to your doctor about getting tested. You can find information about testing options online. I hope that this video has helped you better understand what is schizoaffective disorder and how to cope with it. I myself am diagnosed with this illness, and can tell you that it is easier to deal when I follow these guidelines. Please like and subscribe if this was helpful. Thank you.